미디어 프로젝트 15주 3차 시강의를 시작하겠습니다. 바이오테크놀로지 분야에서 기하급수적 기술 발전을 알아보도록 하겠습니다. 이번 시간에는 생명과학에 대한 디테일한 지식보다는 기술의 큰 흐름을 이해하는 쪽으로 초점을 맞춰주시기 바랍니다. 관련 동영상을 보겠습니다.
Stem cells that turn into cartilage that are cross-linked by UV light that is shown every time a cell is laid down. And they can literally just paint cartilage into someone's knee.
환자의 스템셀과 바이오잉크를 혼합해서 바이오펜으로 환자의 장기를 만드는 연구가 진행되고 있습니다.
Okay, so that's a major advance on the way. Now again, organs, how do we get there? Well, here's a Japanese company that's actually using a robot with 6 degrees of freedom to print a 3D model of a heart valve.
3D 프린터로 심장의 밸브를 만들고 있습니다.
How many people here who know someone who's actually had a valve replacement? Okay, there's a lot of hands in the audience. This is actually a very difficult operation to do, and in addition, it's difficult to, right now, most of our valves are either artificial or they're actually taken from pigs. But what if you could use a patient's own stem cells to print the exact heart valve that they needed for replacement?
현재의 밸브는 인공으로 만들거나 돼지에게서 가져온 것입니다. 미래에는 자신의 스템셀을 이용해서 이를 만들 수 있게 됩니다.
There are a lot of nations getting involved with this. This is an Israeli company that was actually originally a 3D printing company that's trying to get into the game for 3D printing of organs. This is a Japanese company trying to do the same. And they've also had success in 3D printing stem cells. And here you can actually see heart tissue that they developed, that they were able to 3D print. And if you can see, the heart tissue is actually beating like a real human heart.
3D로 프린팅된 심장입니다. 아직 완전하진 않지만 심장처럼 뛰고 있는 것을 볼 수 있습니다.
So not to be outdone, actually in the United States there are a couple of groups. This one is at Wake Forest. They're actually printing molds now to create things like kidneys, human bladders, and even ears, eyeballs. So we're starting with some small organs. And actually, 4 years ago, a gentleman who needed surgery in the UK, who had actually lost a lot of his face, had a 3D scan done, and part of his face was replaced by 3D printing.
3D 프린팅을 통해서 신체의 각 장기와 부위를 만드는 연구들이 진행되고 있습니다. 다음은 마이크로 플루이딕스, 미세 유체역학입니다. 마이크로 나노 크기의 미세한 채널 내에서 유체 및 부위 입자의 거동을 연구하거나 이를 이용한 응용 연구 분야를 통칭하는 말입니다.
Well, basically, this is the idea that you can take a small chip and you could run very small, minute quantities of fluid across that chip, but those fluids can have very special properties that mimic either cells or organs. Here's an example of an institute over at Harvard that specializes in microfluidic chips and design. And here's a lung on a chip.
마이크로 플루이딕스 기술을 이용해서 폐에다가 칩을 넣을 수도 있습니다.
So these are the alveoli, the little sacs that are beating and pulsing that exchange air in each of your lungs. What this chip actually does is it has a membrane that actually mimics those air sacs. And those membrane is actually surrounded by 2 microfluidic layers that allow blood to pass. And then you see these vacuum channels that actually pulse and cause those alveoli to beat. And in doing so, you can actually test pathogens and microbes in the lung or drug delivery.
이렇게 신체와 디바이스가 유기적으로 연결되면서 질병과 미생물에 대한 연구를 할 수도 있고 드럭을 전달하는 데도 사용될 수 있습니다.
And not to be outdone, they're now trying to create organs on a chip for all sorts of organs. You can see lungs, heart, kidney, bladders, knees.
이제는 피해뿐 아니라 모든 신체 기관으로 연구를 확장하고 있습니다.
And then there's the idea of actually creating entire laboratories on chips.
10개의 신체 organ을 한 칩에서 구현한 사례도 있습니다.
So you have entire human bodies and laboratories where you can actually do drug development, drug testing, and drug design.
이러한 디바이스를 통해서 새로운 드럭을 개발하고 테스트해 볼 수 있습니다.
This is a way to actually leapfrog the whole process of drug discovery, which if any of you are actually in the pharma industry know can take up to 10 years and billions of dollars for development.
지금의 신약 개발은 10년의 시간에 수조 원이 들어가는데 이것을 계산할 수 있습니다.
And finally, you actually saw a reference to this. We can actually use microfluidics to diagnose disease. Here's an example of Nicholas actually using blood tests to detect cancer.
간단한 블러드 테스트를 통해서 암을 일찍 발견하는 디바이스도 있습니다. 다음에는 로보틱스의 사례를 보도록 하겠습니다.
Now, how many of you are familiar with robotic surgery? Some people, again. It turns out robotic surgery is not a future thing. We actually do robotic surgery in the OR about 20% of the time to replace laparoscopic surgery. So I spend a lot of time in the OR delivering anesthesia for these kinds of cases. But robots can be used in all sorts of interesting ways. This is actually to replace the hands of a surgeon. But we can use robots in ways that actually assist humans.
현재 로봇은 외과 수술에서 수술하는 데 사용되지만 환자를 돕는 데도 사용될 수 있습니다.
So this is a robot in Japan that's actually being used to lift a patient and put her on a bed. Here's another robot that's being actually used to assist a person so that they can lift and turn people.
입는 로봇인 엑소스켈레톤을 사용하면 부상당하지 않고 큰 힘을 발휘할 수 있습니다. 다음은 재생의학에 대해서 말씀드리겠습니다.
So let's go a little bit into regenerative medicine. A stem cell is something that when you are a fetus has the ability to turn into many kinds of organs.
스템셀로부터 여러 종류의 organ을 만들 수 있습니다.
There's been a lot of controversy for a long time over using stem cells to solve a lot of diseases, for instance, Parkinson's disease or Alzheimer's. Why? Because the most obvious source of stem cells was a fetus.
스템셀로 여러 질병을 치료할 수 있지만 문제는 그 소스가 태아라는 데 있습니다.
But we can now take adult, mature cells, cells, for instance, from your skin or from the fat, and we can actually revert them to a more immature state so they can become anything we want them to be.
이제는 성숙한 셀을 임몰치한 상태로 되돌려서 우리가 원하는 것을 만드는 방향으로 연구 방향이 바뀌고 있습니다.
And one thing that you can actually do with that is use this to give therapy back to people so they don't actually reject the transplant. Another really interesting thing you can do is personalized medicine in a dish.
흥미로운 것은 개인화된 메디컬 디쉬입니다.
Let's say you take a person who has a point mutation and you take and extract their cells, you can put them and grow them up in a dish, actually repair them using CRISPR, and give this back to the patient.
포인트 뮤테이션을 가지고 있는 사람의 셀을 취해서 이것을 디쉬에서 그로우한 다음에 크리스퍼로 진 에디팅을 하고 다시 사람에게 주입하는 방식을 사용할 수 있습니다.
You could also use those same cells to screen for drugs that might be specific to working for that patient.
특정 환자에게서 드럭을 스크리닝하는 데도 사용될 수 있습니다.
So for instance, let's just take a very simple example, high blood pressure. There are lots of classes of high blood pressure medications on the market. And most of the time as physicians, when we prescribe them, they don't work for the people that we prescribe them for. And it takes us months for them to come back into the clinic, for us to try them again.
예를 들어서 블러드 프레셔 경우에 현재 약이 듣는지를 알기 위해서는 수개월을 기다려야 될 수 있습니다.
Change the class of drug, change the doses, and try and figure out what might work. But when you can actually grow up cells in a dish and test them before the patient even takes the drug, it completely changes the landscape.
개인화된 메디컬 디쉬를 통해서 환자에게 약을 복용하기 전에 디쉬에서 테스트를 할 수 있습니다.
Now here's an example of using induced pluripotent stem cells to study a patient with a type of heart disease called cardiomyopathy. This was done at Stanford. And what you can actually see is when you grow up these cells, the two pictures in the top in red and green are examples of what normal patients look like. And they're really, really stereotyped patterns. In fact, the one in green almost looks like a tree with concentric rings.
이것은 심장병에 대한 연구인데 위에 두 셀은 정상적 경우입니다. 이 셀들에 질병이 생기면 서로 간의 박동이 불규칙해집니다.
But when you take a patient with cardiomyopathy and you grow up their cells in a dish, what you actually find is the proteins are completely disordered. And if you now grow them up using induced pluripotent stem cell technology, what you can see here is this cluster of heart cells now beating in a dish, and you can see that the cells are not beating together in time like a person who doesn't have this disease.
질병이 없는 사람과는 다르게 이 셀들이 함께 박동하고 있지 않다는 것을 알 수 있습니다.
Now you can begin the drug screening process. So this opens up a whole new way of doing precision medicine and actually contributing to precision health. Now we can take some of this stem cell technology and do something else very interesting with it. This company, BioQuark, has been interested in the idea of using stem cells to reset all sorts of human diseases.
이 회사는 스템셀을 이용해서 인간의 바디를 리셋시키는 것을 연구하고 있습니다.
This is an example of a salamander. This salamander is an adult organism that's actually lost a limb. And what you see here in this time lapse is that salamander regrowing its limb. Now, we do this as fetuses all the time. Human beings have this ability to regrow organs in utero.
인간도 태아로 자궁에 있었을 때는 이런 일들을 할 수 있었습니다.
But the idea is, if we could recreate that entire chemical milieu in which salamanders can regrow limbs, what else could we regrow? So BioQuark was asking that question, so they founded this company called Reanima. Of all the organs one might want to regrow, has anybody ever thought about regrowing their brain?
리애니마라는 회사는 뇌를 포함해서 신체 장기를 다시 리그로하는 것을 연구하고 있습니다. 다음 주제는 진 에디팅입니다.
So let's go now to gene editing. There's been a lot of interest in gene editing in this audience, as there should be. So CRISPR-Cas9, cutting out and editing pieces of DNA that have gone bad.
크리스퍼라는 진 에디팅 기술은 나빠진 DNA를 잘라내고 에디팅하는 데 사용될 수 있습니다.
Well, the first applications of this actually in adults, not in embryos, but in adults, was actually done on mice at the Salk Institute. And it turns out that a group of researchers there was actually able to partially restore light sensitivity in mice that had lost their vision due to genetic defects. Now, soon on the heels of that, we've actually had companies like George Church's, which, I don't know, they decided that they might want to found a company to, let's say, grow organs again.
유전학자 철치는 돼지의 올간으로부터 인간의 올간을 만드는 연구를 하고 있습니다.
Organ shortage is a big thing, but what's the number one problem with this? Well, taking an organ that's been grown up in another animal often can introduce lethal viruses.
다른 동물에게서 자란 올간을 인간에게 이식하는 것은 바이러스 감염의 위험이 있습니다.
That are not unique to the pigs in which we grow these organs, but they are unique to humans, and they can actually kill the recipient. So just a few weeks ago, the first editing was successfully done in the embryos of these actual pigs to produce little piglets, actually. This was at Oregon Health Sciences University. And what they were able to do was actually edit out the sequences of these ancient viruses that affected pigs but did nothing to them but would kill humans.
연구자들은 돼지에게는 해롭지 않지만 인간에겐 해로울 수 있는 진을 에디팅하는 데 성공했습니다.
So the idea now that we could grow up human organs, potentially using human-induced pluripotent stem cells in other animals, might become a reality.
미래에는 인간의 스템셀을 다른 동물에게서 기르는 것이 현실화될지도 모릅니다.
Raymond referenced this study, just came out a few days ago. Same place, Oregon Health Sciences University. They are the first ones to correct a gene that codes for cardiomyopathy. Do you remember that funny set of beating cells I showed you in a dish? It's a very similar problem, and they were able to correct
한 연구진은 심장 박동에 이상을 일으키는 쥐인을 에디팅하는 데 성공했습니다.
this in embryos. Now, what's even more interesting about this, and something to keep in mind, they didn't just edit embryos, they edited embryos or the cells within the DNA within the germline, which means that this genetic defect, which you would normally pass on to your children, is now corrected forever after in all of your progeny. And that's a huge, huge advance.
이러한 쥐인 에디팅을 통해서 여러분들의 자손에게 전해줄 수 있는 질병에 대해서도 고칠 수 있습니다.
Now, we've been using gene editing techniques to do some really interesting things in neuroscience for a long time. This is actually, this technology was developed in a lab that I did my postdoctoral work in, Carl Deiserat's lab at Stanford. Another major player in this is Ed Boyden's lab at MIT. And the idea here is you take these tiny little microbes which phototax to light, which means if they sense light, they move to it.
이 미생물은 빛을 감지하면 그 방향으로 움직이는 성향이 있습니다.
And what was done is the pieces of the DNA that allowed these little microbes, these unicellular cellular organisms, to respond to light and open up ion channels that would let them move, those channels were cut out, put into the DNA of viruses, and used to infect neurons or nerve cells in the brain.
빛을 반응하는 부분에 DNA를 잘라서 뇌에 이식할 수 있습니다.
And we can now activate nerve cells in the brain using pulses of light.
이것은 브레인의 라이트 펄스에 반응하는 셀들을 가지게 되는 것을 의미합니다.
Now, the problem with this technology, which is called optogenetics, is you normally have to implant an electrode or a fiber optic into the brain permanently. But what if you want to use something non-invasive?
이것은 non-invasive, 비침습적인 방식입니다.
Well, then what you do is put a pressure-sensitive channel using the same technology. In this one, a pressure-sensitive channel was put into the motor neuron of a worm. And that worm was hit with an ultrasound. You'll see that happening up there on the screen, and the neurons being hit with ultrasound, sound waves.
진 에디팅을 통해서 울트라사운드에 반응하도록 만든 결과 벌레가 움직임의 방향을 바꾸는 것을 알 수 있습니다.
And that worm is now changing direction. So we can now use genetics to infect human nerve cells to allow them to be manipulated from the outside of our brains.
이러한 기술 발전이 함축하고 있는 의미는 진 에디팅을 통해서 어떠한 DNA가 우리의 머리에 심어질 수 있으며 외부에서는 그러한 DNA를 통해서 우리의 행동에 영향을 줄 수 있다는 점입니다.
To do things. Finally, we're sequencing entire genomes. Now, what happens if, in the process of sequencing genomes, we detect errors like this? Are we going to get to the point where we're going to allow people to actually come in and actually start editing the germline of their embryos? I want a child who's an athlete. I want a child with a certain eye color, with a certain IQ.
이러한 기술의 발전은 새로 태어나는 아이들의 모든 쥐인을 에디팅할 수 있는 가능성을 주고 있습니다. 우리는 이런 것들을 허락해야 하는가 하는 윤리적 문제에 직면하게 될 것입니다. 어펜딕스입니다. 지금까지 시청하신 것으로 이번 차스의 수업이 인정됩니다. 바이오닉스에 대한 발표자의 강연을 들어보도록 하겠습니다.
So let's move into bionics, and you're going to begin to see how all these different topics weave and overlap. With bionics, what you see here is a 3D printed myoprosthetic hand. It was printed for pennies on the dollar compared to what we used to build in terms of bionics. This would normally cost about $50,000 to build. On a 3D printer, it's a few $100s. A myoprosthetic can actually link up to the muscles, myo, and we can begin to now innervate these 3D printed devices to move them and integrate them with muscle controlled with thought. Bionics has gotten so sophisticated in terms of the biomechanics. I'm going to show you a video. This gentleman up here, has anybody ever seen him before? Any hands? We've got at least a few. This is Hugh Hare. He's a professor at MIT. When he was a young kid, actually less than 20 years old, he was really an avid rock climber, and he lost both of his limbs in a climbing accident. Now, for most kids, that would throw them into depression, but he just decided to fix the problem. So the first thing he did is he went down to Radio Shack, back in the days when there were Radio Shacks, and he started to create and build parts that he could actually attach to his stumps to allow him to climb again. And what you're going to see here is an excerpt of his TED Talk that I wanted to show you to show how advanced bionics has become. What he did was he built a set of limbs that were unique for a woman who was a dancer who had her limbs blown off during a terrorist attack. This was during the Boston Marathon. And this is what you're going to see here. This has sound.
Allow me to introduce Adrienne Hoslett Davis, her first performance since the attack. She's dancing with Christian Leitner.
I thought that was actually pretty amazing. If you look at the biomechanics of that, it's absolutely gorgeous. And imagine now what that's going to mean for people who've lost limbs in wars or through other issues like neurological diseases. Well, this whole new field of bionics and integrating bionics and exoskeletons with humans has become so prevalent that last year in 2016 was the first basically Olympics for people who were disabled but who had basically bionic or other electronic enhancements. So that would have been the world's first cyborg games. And I want to show you an example of how this technology has taken us non-invasively into the future. What you see here is a paraplegic. He basically can't move his legs. And the scientist who's been working with him is someone named Miguel Nicolelis, a Brazilian neuroscientist who now works at Duke in the United States. And what they do is they've built these lower body exoskeletons for paraplegics. These exoskeletons aren't connected to computers. They're actually receiving brain waves that are being picked up from an electroencephalogram, an EEG, that's attached to their head under this helmet. And so what happens is these people who can't move their legs imagine moving them. The EEG signals are picked up, they're decoded through algorithms that have been developed and refined over the years, and that information is sent out to the bionic legs. Those legs now begin to move, and they not only begin to move, they provide haptic feedback so the person actually feels like they're walking again. And on top of it, these people are immersed in augmented and virtual reality to help their training. And the end result is this.
Juliano Pinto helped make the start of the 2014 FIFA World Cup Brazil unforgettable. The 29-year-old paraplegic man successfully made the first kick at Arena Corinthians in Sao Paulo. Pinto wore a full-body robotic suit to help him kick the ball. The brain-controlled exoskeleton was created by the Walk Again Project, an international collaborative effort involving 150 researchers led by Brazilian neuroscientist Dr. Miguel Nicolelis, now based at Duke University. The first step in controlling the suit is easy. The wearer simply has to think about moving. From there, the process gets a little complicated. Nicolelis details it best, saying the human thoughts are detected by sensors and sent to a computer which interprets this information and sends info to the exoskeleton. It allows the patient to control movements on the lower limbs. That's the first innovation. The final aspect is for the exoskeleton to demonstrate the movement. Hydraulic drivers on the suit moved Pinto's legs, which allowed him to feel the vibrations of walking. In layman's terms, that means he felt the sensations of real movement rather than feeling as though he was being carried by a robot. Those who witnessed Pinto's kick firsthand got to see what life can hopefully be like for paraplegics in the future.
So here's the most amazing part. That was already amazing enough. They actually did a follow-up study for neurorehabilitation with 20 of those patients. All 20 of them regained some neurological function. So these people have spinal cord injuries, and in the process of imagining that they were walking, in the process of getting feedback from their legs to their brains that they were indeed walking, immersing themselves in virtual reality, their brains just said, oh, we're whole, and fixed them. So neurorehabilitation without surgery, regrown neural connections without surgery, and that to me was one of the most amazing outcomes of this. So bringing this full circle into the place that this is going is the idea of brain-machine interfaces. What you see here is a picture of the cortex. This is basically a piece of your skull that's cut away, and that's brain tissue underneath. And what you see are a grid of electrodes lying on top. And we do this often in the operating room for deep brain stimulation, for epilepsy surgeries. But in fact, these kinds of electrodes, if they're put in the right place, can actually interpret people's thoughts and help them to move. Here's another example that's a little bit less invasive being developed in Berkeley. So this is basically a piezoelectric device, which means that this is a device that can convert electrical signals into pressure or sound waves, and vice versa. Right now, these are smaller than about a half of the tip of my pinky finger. They are planning on miniaturizing these devices into the size of grains of sand, and they can sprinkle this throughout your nervous system, on your nerves, in order to read what your nerves and your brain are intending and to rewrite and rewire that neural code. And hence, then there's an entire new field that has been born, not pharmaceuticals, but electroceuticals. Another example of actually translating this is the idea of this is sensory substitution. This is for people who are blind. What you see is a device here that was developed in Wisconsin and turned into another company called Brainport. These are glasses that have a camera attached to the front. Now you have a person who has lost their sight, but the camera is actually able to get an image. And what you can see here is it's turning the image into a grayscale depiction with these pixels. And you see that white paddle that comes out? That paddle's a tongue display unit. It sits on your tongue and actually sends signals back to your brain. And so what happens is you end up tasting the world. It feels like little champagne bubbles on the tongue. And here's an example of what this is like for a blind person.
Your brain is what really sees, not your eyes. If your eyes don't work, and you can create another portal into the brain, then your brain is what is going to interpret the world around you.
Brainport is essentially a camera that translates a video image to a plate that I wear in my mouth.
Dad.
Hundreds of pixels on the plate tingle on my tongue, and together they form patterns and shapes that my brain interprets as the space around me.
The information's the same whether you collect it from your eyes or from our cameras with a tongue display. He knows a lot about his environment already through the sense of sound and touch, and this adds one more piece to the puzzle.
I think it's amazing.
I can see it, I just can't grab it.
This is the best part. He's climbing a rock wall with his sense of taste. He can't see. I know, it's amazing, isn't it? So we can use sensory substitution. We can implant devices now to make up for the senses we've lost. This one on the left has actually been FDA approved in the United States. But the true brilliance of brain-machine interfaces is actually seen here. in this next video, and you can see this implanted array of electrodes that's implanted into the premotor cortex. That's the area that actually interprets your thoughts when you think you want to move. And this gentleman, he's not a paraplegic, he's a quadriplegic. He's lost all sensation from the neck down, and yet, what you're about to see on the screen is he is going to use his thoughts to open email, to use a mouse, and to type on a keyboard. Using his thoughts. By the way, Facebook is all over this. They're trying to do this. They just announced at their last conference. They're trying to do this with non-invasive technology. Now, here's an example of a woman using her thoughts to drive a robotic arm to bring a water bottle to her lips. All done by thought alone. No computers in between. So we're using robotics and brain-machine interfaces to give life back to people who have actually lost function. This is a specialized robotic arm developed at the University of Pittsburgh that allows people who are amputees to also control the arm with their thoughts and to get sensation back. So this gentleman actually felt President Obama's hand as he shook it.